Hello, I'm Dr. Anthony Colantonio, and I'm here to tell you a little bit about what are called surgery never events. There are some things that should never ever happen in a hospital, and we have them listed for you, and we're going to discuss them. Those things that should never ever happen. You can take some steps yourself to make sure these never events never ever happen to you, and if you print out the suggestions and bring them with you to the hospital, you will reduce your chances of complications. Take a look at our first slide to see what I'm talking about. These are the list of surgery never events. Number 1, the surgery on the wrong body part, which is when the patient is the correct patient, but the surgeon operates on the wrong part of your body, such as switching from the left side to the right side. This happens quite frequently because of the carelessness of the surgery team, including the surgeon, the anesthesiologist, and the nurses. Number 2, surgery on the wrong patient, which is when the wrong patient is identified and the wrong patient gets the operation performed on them. This happens because hospital team members are rushing to get the operations completed in a certain amount of time. Patients are lined up like an assembly line and placed in large holding rooms. Number 3, wrong surgery on a patient, which is when the patient has the wrong operation performed on them because of a miscommunication between the patient and the surgery team, which again includes the surgeon, the anesthesiologist, and the nurses. Hospitals will try and blame the patient for this miscommunication, but the blame falls squarely on the shoulders of the surgery team. Number 4, a foreign object left inside your body, which happens when the nurse does not count the instruments properly. You might believe that this is the fault of the surgeon, but it is not. Surgeons don't count the surgical instruments, they don't wash or package the instruments, and they don't store the instruments. And this never event happens every day. Number 5, death of a healthy patient after surgery, which is the death of a patient who has a healthy heart and healthy lungs, but dies because of a technical surgical error or a problem related to anesthesia. This is the list of surgery never events, and unfortunately, these never events happen every day, and you can reduce the chances of them happening to you by speaking up and making sure everyone on the surgery team is paying attention. Let's go to slide number 2 for some tips on how you can help yourself. You must take your health care into your own hands, and you must be sure that the doctors and nurses are, number 1, aware of your name, number 2, aware of the operation to be done, and number 3, aware of the side on which the operation is to be done. It sounds simple, but believe me, it happens every day and all of the time, more often than you think, and more often than it should happen. In fact, it should never ever happen. If we look at the reasons why the never events happen, we may be able to reduce their occurrence. If there is any kind of a communication barrier, like a language barrier or an age barrier, or what I like to call a quiet patient barrier, then someone must speak up for you and stay by your side every step of the way. From the time you leave your hospital room to the time you are about to enter the operating room or the procedure room, don't leave your safety in the hands of others who might be rushed or distracted or not properly trained. Yes, believe it or not, there are doctors and nurses who rush or are rushed. There are doctors and nurses who are distracted for personal or professional reasons. And yes, believe it or not, there are doctors and nurses who are not properly trained. Many more than you think. Here are some other helpful hints on slide number 3. And they are hints to avoid wrong site and wrong patient surgery. Number 1, Make sure you have an ID wristband on and the correct name is on the wristband. Number 2, make sure everyone is paying attention when you speak with them. Number 3, make sure the room that you are in is quiet and the nurse or doctor has your undivided attention. If not, speak up, shout out if you have to get their attention. Say something to make sure the doctors and nurses are listening to you and not listening to someone else. Make sure they are not rushed and are not rushing you through the system. Make sure the doctors and nurses are treating you like a human being should be treated and not like equipment on an assembly line. Doctors and nurses are rushing through their days because of the business of medicine and the heavy schedule that they have and the overcrowding of patients and the overcrowding of operations, all to make more money. If you don't speak up and get everyone's attention and make sure there are no distractions, then you might become a statistic. You might become a never event. If your loved one becomes the victim of a never event, ask to see the never event report that must be filed with the local or state Department of Health. And be sure that the report is completed properly and filed properly. If not, then you should call the local or state Department of Health yourself. You can find that number on this website, and you should report the incident yourself. This will hopefully prevent this injury from happening again to your loved one and also to others. If you would like to hear more about other never events, the ones called care management never events, please see our video on that topic included on this website. If you or your loved one has been injured and you need advice on whether to report the incident or how to report the incident, please call me. The toll-free number is 855-832-5757. The call is free. The advice is free. Just call the number and be sure to ask for me. Ask for Dr. C. Thank you very much.